Good evening, everybody. I am Dr. Rodney Hood. I am the president of the Multicultural Health Foundation and chairperson for the San Diego County COVID Equity Task Force. Welcome to this evening's event. Before we get started, I'd like to invite Pastor Miles McPherson to give prayer. Pastor McPherson. You're on mute.
Thanks a lot, Dr. Hood. Let's all bow for a word of prayer. Lord, thank you so much for this opportunity to hear from Dr. Sims and all his wisdom and experience down in the bubble. We know that COVID has impacted all of our lives in so many different ways. So we pray for wisdom and insight and new ways to be safe and to flourish amidst this season. In Jesus' name, amen.
So thank you very much. On behalf of the Multicultural Health Foundation, the San Diego COVID Equity Task Force, and the County of San Diego, thanks to everyone for joining us this evening. We are very excited to be here with you, and we have an engaging and an enlightening program planned for all of us this evening. Nationwide, people of color are being disproportionately impacted and are 2 to 3 times more likely to get infected and die from the COVID virus. We remain committed to changing this statistic. In fact, very soon, we are excited that the Multicultural Health Foundation, in partnership with the County of San Diego, will launch our Together Against COVID program. It's a campaign focused on the Black African American community of San Diego. However, before we get started, just some housekeeping and a few quick tips on how to use Zoom. You can use the chat feature to submit questions throughout the program. We have a team who will be monitoring the chat in case you have any questions for Dr. Sims during the Q&A period. If you have any connection issues, which I have had in the past, you can try exiting the Zoom meeting, quitting your web browser, and then rejoining. Now, many times that resolves the issue. But we will also be recording this event in case anyone does run into technical difficulties. We also have a survey we would like those in the audience to complete. This survey will help inform our efforts to reduce the spread of COVID in the region of San Diego. So please, when you have a chance, fill out the survey. The survey will be link to do the survey will be listed in the chat and will also be sent to you in a thank you email you'll receive once completing this event. As past president of the National Medical Association and a member of the NMA Task Force on COVID, I would be remiss if I did not acknowledge our current NMA president, who has joined us, Dr. Leon McDougall, our immediate past president of the NMA, Dr. Oliver Brooks, Dr. Vivian Penn, who serves as president of the NMA Past President Council, and who is retired as director and first NIH director, Office of Research of Women's Health. There are other past presidents and members of the NMA Task Force. Welcome. We would also like to acknowledge California Assembly Member Dr. Shirley Weber, San Diego County Board of Supervisors Nathan Fletcher, San Diego City Council Member Monica Montgomery, and City Council Member Monica Montgomery, congratulations on your new marriage. And to Mr. Nick Macchione, the Director and Deputy Chief Administrative Officer of San Diego County. All who are with us in this audience tonight, and we should all thank them and congratulate them on the great work they are doing to help San Diego and California navigate the pandemic and ultimately save lives. Our program for tonight, as you will see on the screen, will conclude at 7 p.m. First, we will hear from Dr. Holly Yang, who will kick things off with a greeting. Then Dr. Wilma Wooten will provide some local context about how San Diego has been faring in this pandemic. Next, Pastor Miles McPherson will introduce tonight's keynote speaker, Dr. Sims. We will see a brief video to give everyone a look into how the NBA was able to pull off what has become pretty much universally recognized as a resounding success. And after that, Dr. Sims will give his presentation and we'll conclude with questions and answers and a rapid fire segment to finish the evening. So with that, I'd like to introduce Dr. Holly Yang. She is president of the San Diego County Medical Society, representing over 5,000 physicians. Please welcome Dr. Yang.
Thank you for the introduction, Dr. Hood, and thank you for all your work and to those on the task force. And I'd really love to just welcome all of you for joining us with this special event. I am really grateful to serve the patients and physicians of San Diego and to be part of a community that takes COVID-19 and the issues of health equity seriously. The work of this San Diego County COVID Equity Task Force is critically important to move towards a better future despite the current crisis and the challenges that we now face. I'm pretty proud to have members of the San Diego County Medical Society as part of this task force, including Dr. Hood and Dr. Wooten, and working hand in hand with leaders in our community and local government for the health and well-being of all San Diegans. We must work together and we all learn from each other. That's the only way we'll sort of get through this successfully. And having Dr. Leroy Sims here to share his unique experiences with us is a very special treat. So as our the 150th president of the San Diego County Medical Society, on behalf of our members and of our wider San Diego community, I'm really thrilled to virtually welcome you, Dr. Sims, to San Diego. At this time, I also want to put out a special welcome and thank you to our own very special public health officer, Dr. Wilma Wooten.
Thank you, and good afternoon, everyone. To get started, I just would like to share a couple of slides with you to give you an overview of the status of COVID-19 in San Diego. And the next slide, we have an epi curve that actually shows by illness onset date, the cases that have occurred in San Diego County since the latter part of February, but the first actual local case occurred in early March. Now, as you see, in the early part of the pandemic, we were trailing along, and then when in middle June, when many businesses were opened up again, we saw an increase in the number of cases, and that resulted in the state implementing more restrictive measures. And we saw that our cases decreased. And this is with the non-pharmaceutical interventions that we commonly tell people to conduct, and we'll be sharing those with you at the end of this presentation in a couple of minutes. Then at the end of August, we saw the blueprint for a safer economy rolled out by the state, and it allowed through a tiered system various businesses to open up based on the spread of the disease in the region, whether it was widespread, substantial, moderate, or minimal. And the last bar at the far right basically is the incubation period. And while the numbers are lower than most parts of the rest of the most recent activity, we know that additional cases will occur there. So currently San Diego has 53,000 cases of COVID-19, and 62% of those cases are in the Latinx population. In the next slide, I want to just share with you information about our T3 strategy, which is focused on test, tracing, and treating patients. As it relates to test, our slogan is that we want to provide accessible COVID-19 testing for everyone. And to date, we've had a 7-day average of daily tests reports at 10,617. When it comes to tracing, 96% of our case investigations, as well as contact tracing, have been initiated within the first 24 hours. And then finally, within the treat category, we include assistance with safe isolation as well as quarantine. And we have provided a 7-day average of individuals in our public health rooms. Then that number is 98. Cumulatively over the entire pandemic, we've housed either isolation or quarantine 1,899 individuals. In the next slide, we emphasize to the general public that it is important to be tested, because by testing, we remove individuals from the general public. If they are positive, isolate them and identify their contacts so that they can be quarantined. Testing helps to prevent the spread of COVID-19. So we encourage people to first start with their healthcare professional. And if they have symptoms, request to be tested. And if their provider cannot provide testing, then they can go to any one of our currently 61 testing sites across the county by calling 211. In the next slide, in closing, why does it matter that we do or recommend these non-pharmaceutical strategies every day? From washing your hands and adhering to proper sanitation measures, keeping 6 feet apart, wearing a face covering, avoiding crowds, gatherings, and parties at your friends' or family's homes. And most importantly, staying home if you're sick. Conducting or implementing these strategies help to decrease testing positivity rate, which in turn helps to decrease our case count, which is what keeps us in a specific tier status. And if these factors, these two metrics that are used to monitor counties across the state, decrease testing positivity and decreasing case rates. In the next slide, if these things occur, then this allows for more sectors within the county to open. But this is a balancing act, because as we have more sectors opening, more, we know that we will see more cases. So again, adhering to those strategies will help to decrease the number of cases in San Diego County. Next slide. Dr. Hood asked that I show some accomplishments based on what we've achieved in San Diego in response to COVID-19. I just want to share that our county has tested over 110,000 individuals out of the 1.3 million individuals that have been tested across the county. And we also have implemented contracts with community partners to conduct contact tracing, as well as contracts with community partners to conduct outreach and education to reach the various diverse populations that are at greatest risk to exposure to COVID-19. We've developed 22 sectors to conduct outreach and education, as well as conducted over almost 60,000 case investigations and over 46,000 close contact investigations, ensuring also that we have a diverse workforce to reach these individuals. So these are just a few accomplishments. The next slide just shows in the next slide, and this is the last slide. It just basically shows the investment that the county has made related to economic assistance programs to those individuals that are on the front lines, that are vulnerable. And we've created a daycare assistance program, as well as a positive recovery stipend program, where over 500 individuals to date have become eligible to receive a stipend support while they are recovering from COVID-19. So I will close there, and I would now like to introduce, in the next slide, I'd like to introduce and welcome someone who needs no introduction and is no stranger to our San Diego community, our own Pastor Miles McPherson.
Thank you.
And he is the pastor of the Rock Church. Thank you.
Thank you, Dr. Wooden. Thank you, Dr. Hood. Thanks for inviting me. How you doing, everybody? First, let me say thank you for the opportunity to host today. Councilwoman Montgomery, God bless you. Congratulations on your wedding. I didn't know that. That's great. Dr. Wooden, someone was asking, are the slides going to be available to people? Can they get those slides? I saw someone in the chat ask that.
Yes, absolutely.
Okay, if you could put in the chat how they would get that. My name is Miles McPherson, pastor of the Rock Church here in San Diego. We have 6 physical campuses and 1 online campus. So, 180 employees and thousands of people that go to church. So we have been shut down since March. We are now having outdoor services, but no indoor services. So COVID has hit us really hard, just like everybody else. And we're managing that and have a lot of questions as well. But I'm here to welcome Dr. Sims. Dr. Sims, welcome to San Diego. You are with family. We got a great community down here. And I could tell by just our little interaction, you need to come down here and live and work, because we can hang out. I want to give you all an overview of Dr. Sims. You're going to hear about him. He is the Vice President and Medical Director of the NBA. And that's cool. The athlete himself ran track at Stanford. Is that correct? And Dr. Sims led a team of hospitals, clinics, physicians, first responders to create the NBA bubble for 22 teams. And there were no cases, if I get that right. It was an incredible feat. He is board certified in emergency medicine, primary care, sports medicine. He's a partner with Mills Peninsula Emergency Medical Associates and practices emergency medicine at Mills Peninsula Medical Center in Burlingame. And he has an extensive background in sports medicine as a faculty at Stanford and as a medical director for the United States Olympic Committee, Golden State Warriors, and various Stanford University athletic teams. So obviously he knows what he's talking about. We're looking forward to what you have to say. You're going to see a short video, and then next voice you're going to hear is Dr. Sims. And after he gives his presentation, we'll go into a conversation and do a Q&A. So thank you.
I was quarantined for 7 days with really nobody on campus.
I see you masked up.
Oh man, they serious around here. You gotta keep this mask on.
How's the food there, man? I'm seeing pictures on You gotta be 6 feet away from each other, sir?
Same thing. You gotta be 6 feet away from each other. They got trackers on your credentials.
What?
Yeah, and it goes off if you're within 6 feet of somebody. They ain't playing.
I see.
Welcome to the NBA campus, right here in Walt Disney World, home of the 2020 NBA Finals. All 22 teams are housed in 3 different hotels. Behind me is where the top teams, standings-wise, are staying.
We've spent hours and hours and hours over the last few months planning for this NBA campus. Once we felt comfortable that we could actually do this and keep everybody safe, that's when we decided to move forward.
The proposal has been approved, a 22-team restart.
Just competing, going against somebody and someone trying to stop me and me trying to stop them. That's something to understand.
We definitely all excited just to get out there.
It should be fun to get back out there to do what we love.
This is an unbelievable job, everyone that made this happen. Obviously, big shout out to the players. A lot of stuff had to be discussed and talked about to get down here. As nice as it is to be back on the court, I don't think any of the players down here has lost sight of the different social injustices going on.
These guys didn't go down and forget what was going on in the rest of the world. They continue to protest. They continue to shed light on, honestly, the bigger issues that are bigger than basketball.
We want to be on the leading edge of what we're doing. Our health and safety protocols have been reviewed by the likes of Dr. Anthony Fauci, who said that he was impressed with what we're doing. Part of having the best is the incorporation of technology. These magic bands not only are the keys that open your door, but through several checkpoints, everyone can scan. And if they've done everything, they've checked their temperature, their symptom screen is negative, they don't have any symptoms, and their tests are negative, when they scan at a checkpoint, they get a green and they can proceed. But if something is off, we have health monitors that can open up the app and see what's wrong. None of us want to take unnecessary risks. If we're going to ask this of them and of each other, we want to make certainly sure that what we're doing is on point. And I think that what we're doing is on point.
What do you hope will be the lasting memory of this whole experience while you guys are here on the webinar?
This is a once-in-a-lifetime opportunity to play in this bubble. Right now, it might be a little uncomfortable for some guys, but I think you're going to look back and be like, honestly, that was sort of cool. It was sort of cool to go down there and play. Sort of like a camp style, have all these teams and guys around all the time, but I doubt this will ever happen again. So it's an opportunity in both aspects, the social justice, but also basketball-wise.
I guess I'm up. That brought back memories. I've only been out of the bubble 8 days, so still really fresh. My name is Leroy Sims. It is truly an honor and pleasure to be here with you today. And I don't say that lightly. This is an opportunity for me to be amongst the community, to be amongst some people who I admire in medicine, to share my experience, what I've learned, and see how we could be forward-looking with the information we've learned from the NBA and apply it to the broader society and to the San Diego County community in particular. So truly a pleasure. Thank you to the San Diego County COVID-19 Equity Task Force for this invitation to be here with you today. I'm truly grateful for the opportunity. I want to thank the National Basketball Association for the support that it has given me in this role. Our partners at the National Basketball Player Association, everything that we did was in lockstep with them, and we could not have done this without their support. So truly, this is just a fantastic opportunity for me. So what I'm going to do is spend some time talking about the bubble, but really what I want to do is leave time at the end for Q&A and to have a discussion. So I have a few slides. I'll go through them relatively quickly so that we can get more into the conversation, because I think the questions are really where the knowledge and the fruit of this lies. For starters, I'd like to mention that I have nothing to disclose. There are no conflicts of interest. I'm not being paid by anyone that I speak about or corporate entity that I speak about in this talk for complete disclosure and transparency. So I'll give you a look at the inside of the bubble as it was defined, and then do a post-bubble review. You know, what are some key takeaways, and then spend the closing moments of this presentation talking about building towards future successes, and the 3 C's as I call them, and then we'll open it up for Q&A. So let me start by talking about how we got here, and I'll be brief. Recall back in March 11 to be exact, one of our players tested positive. And at that time in the United States, we really weren't promoting mask wearing, social distancing, testing the way we are now. It was a different time. So that one exposure let us know that we have probably exposed lots of other people with that one person testing positive. And so it was really difficult for us to continue playing basketball, knowing the amount of contact that one player had had with his teammates, other players on other teams, officials, and other staff. So really our hand was forced, but we immediately started thinking about how we could safely return to basketball if we were going to do it. And that work went forward. We consulted infectious disease experts, epidemiologists, sports medicine physicians, statisticians. We talked to testing companies, manufacturing companies that made the testing platforms, the large testing corporations. We really did our due diligence. I even spoke with a mathematician from UCLA to do some predictive modeling of where would we be if we had one bubble versus say 2 bubbles? Would we have twice the risk? Would the risk be exponentially higher in trying to divide the labor? So we really went at it hard. From there, we talked to other leagues, the NFL, MLB, MLS, the Bundesliga, Premier League Soccer, La Liga, Australian Football League, the IOC. This was a very collaborative effort. Nothing that we did was singular. We definitely did this in collaboration with lots of other entities. And from that point, we put forward our health and safety protocol, and the players ultimately agreed. There was definitely pushback. There were things that they said that we cannot do it. If this is the case, we can't go forward. One of those things being, if we're going to go 3 months, at some point, we need to see our family. And if your protocol is such that we can't see our family for a total of 3 months, we don't know if we can do it. So we had to find some way to have compromise. This was a partnership. This was a collaboration. And this is something that I did not do by myself. I had lots of help, lots of friends, lots of colleagues making it happen. So as we got down to Florida, the cases started to go up. We were surrounded by community cases where Florida was essentially the epicenter. I mean, topping 15,000 cases in a day. But what we did know was that we had created an environment such that we felt comfortable and confident going forward. The Department of Public Health gave us the green light, and we had all of the buy-in from the stakeholders to say that we could go forward with the game, and go forward we did. By the time that we put the bubble in place, we were able to get our testing done with quarantining on the front end, routine testing, and implemented our public health and safety strategies. And it is true that we did not have any cases of COVID amongst the players once we got into the bubble. We did have a couple cases amongst the staff who broke the rules, but among those, I mean, it was a lot, not even a handful, fewer than a handful of cases. And that it is just simply a point of pride to believe that we could get there. We knew that success was possible, and we believed that it could be done, and ultimately we were able to do it. And so that's the background of what we were facing as we got to the bubble. One of the most important things that was said to me and to the group, that if we were going to go somewhere, have a bubble, and do testing, first and foremost, we could not be a detriment to the local medical community, to the local health resources. We could not take tests out of people's hands and out of the hands of first responders. The NBA, along with the players, put together a program called NBA Together to assist communities that were impacted by the coronavirus pandemic. We raised money, we donated PPE, we did pop-up testing events. Players did the same. We donated we donated tests themselves in this effort. And so we made sure that whatever we were doing, wherever we were going to be, that we augmented whatever the local resources were, and the teams did the same. So not only did the NBA do that in Orlando, the teams did that in their various markets as well. It was a large collaborative effort from a social responsibility point of view. So the bubble, this was touched on in the video. It really wasn't a bubble, but it was a campus. It was multiple campuses. Our primary campus where the team stayed was the Coronado Springs Resort. We had complete control of that resort, the Grand Destino Tower and the hotels around it. We also had partial access to the Yacht Club and the Grand Floridian where we housed teams. But as we moved forward and we lost teams, we closed those outer campuses, Yacht Club first, followed by Grand Floridian. And then we played our games at the Wide World of Sport Complex. It was called the bubble because essentially we put a perimeter around each of those campuses, and we very much controlled access of who could come. In terms of the bubble, the green zone, as we call it, were people who had quarantined and were being tested every day. The people who weren't in the bubble but still working there were in what was called the yellow zone. Those were people like the Disney workers, our drivers, the service workers who were staying at home, coming and going, not quarantining, being tested somewhere from every day to every 3 days, but they were outside of the bubble itself, sort of the green zone, as it were. So an overview of our health and safety protocols, and these should all look pretty familiar. We asked all of our guests to test inside the bubble. And we did that via PCR test. And I'll talk a little bit about the distinction of the tests as I go along. We asked that they adhere to social distancing, hand sanitizing, washing their hands or sanitizing them. We had strict cleaning protocols for all aspects of the campus, from the hotel rooms to the lounges, the courts, the rims, the balls, the chairs in the gyms, everywhere you can think of. All of the high frequency touch areas, the buttons on the elevator, those were being wiped down. And then we said, guests, don't leave the campus. We didn't force anyone to stay, but if you left, you could not come back. And that was the agreement. And then finally, we did daily health screenings, symptom checks, asking people if they've been exposed to people who've tested positive, checking temperatures, the whole gamut. That was part of the daily operation. So what that looked like was in part your bread and butter, thermometers, pulse oximeter, and in part technology. So the people in the bubble, all of them had a thermometer where the results from the thermometer would Bluetooth into your app, the health and safety app that you checked into every day, as did the pulse oximeter. I mean, I will admit, temperature screening, we didn't have a high yield in terms of the number of fevers on the whole for people checking every day. We also did temperature screening at entry points to our various locations, and we didn't have a very high uptick there. Again, earlier on in the pandemic, that was something that was seen as more or less being a requirement, but we saw over time that it was not as useful. In terms of the pulse oximeter, that was something else. Really, we saw the best value with that for people who had tested positive or people who were ill to track their progress. And we did, one of our first cases who was a vendor who was in the yellow zone, not staying in the bubble, who tested positive, we actually noted that he was starting to desat. He went from 97% to 94% to 90%. And in that short window where his oxygen saturation was going, he actually felt fine, but we were able to get him over to the hospital. And within short order of being in the hospital, his clinical status started to deteriorate, but he did ultimately make a full recovery. And the pulse oximeter was one of those pieces of technology that helped us pick up something ahead of time. So what did our day-to-day look like in the bubble? As I said, testing was the cornerstone of the whole project. So we COVID tested every day. We asked people to log in their symptoms every day, as well as checking their temperature and pulse oximeter. The Magic Band incorporated all of this and allowed us to basically have checkpoints around the campus. So if someone didn't test, or if someone's temperature was elevated, we would capture that data and it would translate into the Magic Band. So when they went to scan, they wouldn't be allowed to proceed. And then we had health monitors at the various checkpoints to show that, hey, this person has something that's awry, and they could intervene. They can let a doctor know that this person had symptoms, or we can say, hey, you didn't check your temperature, and we could check it on the spot. That was part of our health checks. We did have proximity monitors to remind people you're getting too close, and everyone had this on their credential. It was not a GPS tracker. It didn't track movements. And people were concerned about that we were going to be tracking their movements. And that really wasn't what our strategy was. It really was just to have an additional layer of reminding people of not getting too close. And people really don't have a good sense of how far 6 feet is, as it turns out, but that helped. And then we did do some research with the Oura Ring in terms of symptom monitoring to see if we could connect symptoms with predicting whether or not someone would convert to being COVID positive. This I just touched on, so I'll keep moving forward in the interest of time. So testing, as I said, testing was the key. We tested every day. We did PCR swabs for those who were in the bubble. So there are various types of testing. The PCR test is looking for particles of virus. That's not to be confused with the antigen test, which is looking at parts of protein that's associated with the virus. We use the PCR test. It's more sensitive, but it also takes longer to get the result back. So therein lies one of the difference between your PCR test and your antigen test. The antigen test is like the flu test. It's sort of rapid and you can get it back within 30 to 60 minutes. The PCR test, there are some rapid PCR tests, but those are in high demand. And in general, they're reserved for hospitals, high-risk individuals, in situations where you need that answer and 4 to 12 hours would be too long. Aside from the PCR test and the antigen test, there's one other type of test that's available, which is called serology testing or antibody testing. That testing isn't looking for the virus. That testing is looking to see if your body has been exposed to the virus and if you've had an immune response to that. We definitely offered that as well as a part of our testing strategy. And you can see as we set up our testing rooms, it was socially distanced. Our testers were in appropriate personal protective equipment, PPE, and we proceeded with this regularly. Once we got other guests on campus, the player guests, when the playoffs started, we did have pediatric patients who were around, and we had to be sensitive to the fact that if kids were going to test, we needed to set up an area where they felt comfortable testing. So in all matters, we paid attention to the data and to the experts. We talked to pediatric infectious disease experts, Dr. Bonnie Maldonado at Stanford. We talked to pediatricians to say, hey, what is the best way to do it? What's the youngest age can we test? How should we go about it? And the kids loved it. We gave them prizes to incentivize the testing for the nose tickling, and it worked out very well, but definitely we had to be understanding of who our patient population was and how to incentivize the testing among them. A brief note, when we did have positives, primarily in the yellow zone, we had a protocol in place. We also had a contact tracing program that was in place as well. And those are the tenets of the COVID response. Not only do you have to test and do surveillance, but you have to have a robust plan in place. And it sounds like down in San Diego that you all have that. 61 testing sites, I mean, that is where it's at. But also to be able to take someone who is positive and separate them from others so that you reduce the risk of spread in the community, that is what you need. And you need to be able to find out who those people who tested positive have been around and what their risks are and how can we isolate them. So those tenets of our program down in the bubble is exactly what we just heard is happening in San Diego, and hats off to you. One important point that I want to mention, and we can delve into this in the Q&A, is that as we set up our health and safety protocols, the medical was as important as the mental health. And that is something that I found to be one of the most useful resources in the bubble. People being away from home for extended periods of time, being away from their family, being isolated, not being able to go around as they please, people being sick, not even with COVID, but not being around their colleagues. It was a mental burden. And so we partnered with our mental health providers, clinical psychologists, sports psychologists, to have resources available to people in the bubble from the start to the end. And it was highly utilized and highly appreciated that that was there. We have an emergency action plan on the medical side, and we have a mental health emergency action plan. And that was something we set up. But we understand that there is a stigma that's associated with mental health and behavioral health, psychology, and psychiatry. So we also made sure we had access to chaplains, that if people wanted to access someone through a more religious or faith-based route, that that resource was available as well. So I found that all of those things were important for the success of our bubble, not just having the medical resources, but other resources that people needed to get by during that 105 days that we were down there. So the post-bubble view, I'll start with this quote, which is from my high school, The Deed of Gift from Phillips Exeter Academy. And in that, there's a quote that I really love, which says, "Goodness without knowledge is weak and feeble, yet knowledge without goodness is dangerous. Both unified form the noblest character and lay the surest foundation of usefulness to humankind." And I found that this quote is so applicable right now to what we're facing with this pandemic. There are a lot of people who may have good intentions, but they're not pairing it with the knowledge that's going to do the best work. And there are people who are armed with the knowledge, certain physicians who may be spreading misinformation. And that knowledge, if it's not paired with good intention, is dangerous, that misinformation. And so this is something that I come back to, and I find it to be very relevant and applicable to what we're doing. And I like to be in a position of making sure that I am pairing my medical knowledge, experience, and expertise with goodness in terms of giving back to my patients, being an advocate, and making sure that I'm sharing the resources to help others. So what are the takeaways? What were the advantages that we had in the bubble, and what were some of the challenges? So I'll start with the advantages, is that first and foremost, we knew that going back to playing basketball, this was going to be bigger than a game. And the players let us know this in no uncertain terms, that they didn't want to lose that platform, that opportunity to have a voice. The social injustices that we were facing were something that the players wanted to highlight, and we wanted to make a difference and an impact on, from having Black Lives Matter on the court, to the names and the messages on the jerseys, to the players taking a stance with the Jacob Blake situation in Kenosha and saying, you know what, time out, now is not the time for basketball. They knew that getting back and playing would have an impact, and that there would be an advantage there. And so that was a factor. The social responsibility that I told you about, making sure we weren't a detriment to society, but we were giving back to society, was another one of those advantages of having the bubble and a part of the success. And obviously the economic factor. We were down there because basketball is a business and people wanted to recoup some of the money that was being lost from having not played. And so that was also there. The NBA wasn't immune to the economic downturn. One of the advantages was that we had resources, we had personnel. We had personnel for the teams, we had personnel for the staff. And so that was great. But another resource was the security, or the enforcers, the people who were there to say, put your mask on, you're too close, making sure that if people left, they couldn't come back. So people to enforce the rules was one of the big advantages that we had, to enforce that compliance. Obviously, we had penalties if people did not follow the rules, including allowing people to have an opportunity to share infractions, but in an anonymous source, so that people didn't feel like they were necessarily being outed for just trying to help others adhere to the rules. We wanted to be a paradigm. We were the first sporting league to stop. We were one of the first to start back. We wanted to show that you could come back, that you could do it in a way that was socially responsible, that you could have a message that was on point in terms of the greater society and impact, in terms of Black Lives Matter. We wanted to show that you could do this in such a way that you could keep people safe, even surrounded in a community like Florida where the cases were going up. And also we wanted to be our own case control, to show how could we be good for next season? How could we be a model for testing companies, for departments of public health, for the greater community, other sports, etc. We very much look to be a paradigm, and that was one of the advantages and motivations. And finally, the foundation that we had, the credibility that we had within the institution, the doctors, the medical providers, with our staff, with our players, with the leaders in this society. That trust was really important. They had to believe that that health and safety protocol that we put in place was going to stand up, and that we weren't putting them at risk, that we weren't taking people from their homes and putting them in an unnecessary risky situation. Our integrity was on the line, and our open communication was there. And I think those were the advantages that really helped us succeed and go forward with that bubble. Now, there were definitely challenges. Time was one of the biggest challenges. We worked incessantly from April all the way until last Monday. And in fact, people are still down there breaking down the bubble. People were working around the clock. They were fatigued. There was that set in. People were away from home for long periods of time. That was a challenge. Space was another challenge. If we could have, we would have brought all 30 teams down, but we were resource limited. We didn't have infinite number of personnel. And so we had people doing multiple duties. Some people were doing 2 and 3 jobs instead of the one that they were necessarily hired for. And that was a constraint. We really pushed people to the brink. But again, we were limited because we couldn't bring 5,000 people into that bubble. We had to set a number and adhere to that. And that number was what we deemed to be the safest in terms of the number of teams and the number of staff, media, et cetera, to execute. A major challenge was attention span. And we see it now. People are getting tired of wearing masks. People are getting tired of socially distancing. People are getting tired of not being able to go to their favorite restaurant, to spend time with their family, with their friends. And that attention span, that fatigue was really a challenge. And I'll talk about how we combated that in a little bit. You know, people did have some issues with compliance, not a lot, but when they did, you know, they had to, you know, pay the consequences. And then one of the main challenges, just being a league where there are people who are making millions of dollars and people who are hourly employees, were that there were people who wanted to be exceptions. A lot of people wanted the exceptions. hey, you have a 7-day quarantine, how about 4? And we knew that the exceptions would unend the bubble, and we needed those exceptions to not be there. We had to stick to our guns, which we did. We knew we were going to have to be strict, which we were, and we didn't budge on those principles. But, you know, it made people like me and the security guys the bad guy. We had to be the bearer of bad news at times. And those challenges were there. And again, we can dissect that a little bit more in the Q&A, but we definitely had our challenges on our hands. So in terms of the bubble, how can we be successful? How can we build as a community on the successes of the bubble? And so the 3 C's that I outlined are, number 1, cooperation. This was a team effort. You have to call on the experts. You have to rely on people in the community to unearth some resources that may not have been there or may have been untapped. You have to define your populations. Who needs access to this testing? Is it the students? Is it the teachers? Is it both? If we're resource limited, who are we going to target? And as resources improve, we can expand. But that cooperation has to be there. In order to have that cooperation, the next C you have to have is communication. Where to test is one of those important things for the community. The type of testing options and being able to explain that to people. What's a PCR test versus an antigen test? What are the different ways to get tested, a nose swab versus a mouth swab versus saliva, and making sure that people understand those differences. In terms of our communication, it was written, we did virtual presentations, we did in-person presentations, socially distanced, of course. We reinforced that with videos, and when we had given those messages, we came back a couple weeks later and re-emphasized those same messages. We opened ourselves up to Q&A. We made sure that when people had questions, we addressed those questions, that we didn't dodge the hard questions of why are we doing this? How much longer? When is this over? Why do I have to keep doing it? We had players say, if we're testing every day and we're not wearing masks on the court, why do we have to walk around with masks on the campus? That's a tough question. And that's a question that we had to stand there and we had to answer, but we had to address it head on. We got a question from a player that said, what are you all doing to protect us from 5G radiation in the bubble? Now, some people would want to dismiss that question. You dismiss a question from someone and you lose their ability to want to buy into your program. You have to answer the questions and say, hey, look, this is what you have to understand about 5G and that risk of radiation is actually not there, and here's why. But it means you have to be read up, you have to do your research, and that was important. But facing that head on, delivering that message, honing it back in over and over and over is really important. Some people are audible learners, some people are visual learners, some people learn through repetition, and we made sure to address all of those frequently to improve our compliance, and compliance was the last thing. Now, this is tough because the question really comes down to who is enforcing the rules. Some of it is I being my brother's keeper. Other parts of it is that we need other people to support the message and the compliance. How do you build that self-monitoring? How do you build that community monitoring? How do you build that trust for people to buy into what it is that you're trying to offer in terms of this pandemic and testing, contact tracing, social distancing, and the like? And those are the principles, I believe, that are going to be most necessary for building that success, that cooperation with the community, the communication, and ultimately devising a strategy for compliance to make sure that people are adhering to it. It's going to be utterly important as we get into the vaccine season, like the flu vaccine and ultimately COVID vaccine. In Q&A, I think I'd like to talk a little bit about that and building up that trust in the community as it relates to vaccination, because I think that's a key part of where we're going to be headed. I know some people don't want to get vaccines for various reasons, and we have to explain the importance of the vaccines, the safety of the vaccines, and why it's important, not just for me, but for me to help my mom and my grandpa in getting that vaccine as well and being able to move around like we used to. So those are the points that I had. I know I went a little long. I tried to get through it as quickly as possible. I will stick around for Q&A as much time as we have. So I'll stop there and turn it back over to Pastor McPherson.
That's an amazing presentation. Thank you for that. We have about 20 minutes or so, so we'll get through as many questions as possible. When I look at that, I can imagine the millions and millions of dollars it was to create the bubble. So here we are in the jungle outside the bubble. And so we want to break this down to how we can practically benefit from some of the things you learned without having the technology and all the guidelines and the pressure, that all the players had, the guidelines they had to basically comply to, where now you're out here with people who say, I'm going to do what I want. So I'll just get through some questions when it comes to children. And I have 10 questions that have been submitted, so I'm going to kind of try to combine them. When it comes to children getting tested, either going to school or going to church, and the people, for the parent, what would you say to the parents and the organization, the school, the pastors who are taking these kids in? How can we keep them safe? I know you talked about the tickle. I heard it's not literally a tickle, but how can we be safe, extra safe with our kids?
So remember, when information changes in medicine, it's not a flip-flop. When we pivot with information is because we have more data. So in the beginning, we were being told through the research that was coming out of China and South Korea and Italy and Europe that kids weren't really susceptible. That's in part because we didn't have the data. And as time progressed, we saw that kids actually can get the coronavirus and they can transmit the virus. And so now we know that it's important to test kids because they can be carriers and they can spread, and kids can have significant problems as it relates to the coronavirus, like the Kawasaki type syndrome that they can have. So I think testing kids for school purposes is important. Children actually have been pretty compliant when it comes to masks, but the tough part I've seen with children is the social distancing. They, especially having been away from peers for so long, they communicate, they're tactile, they want to be close. So devising a program for testing, I do believe is important for the safety of the school, their cohorts, their grades, but also the schools in general, to be able to keep them open. Now, when we talk about the tickle, remember, there are different nose swabs. There's the anterior swab, which goes right up under the nostril. There's the mid-turbinate swab, which goes about here, halfway in. And then there's the deeper, the nasopharyngeal swab. You're not going to be able to do a nasopharyngeal swab on kids very often. The anterior and mid-turbinate are the ways to go. And we found success with that in the bubble. Now, there are other ways of doing testing. And then there's oral testing and there's saliva testing. So looking into the different methodologies for testing becomes important. You touched on cost. One of the things that the NBA did was that we partnered with Yale to help create a test, Saliva Direct, that would be low cost. The test, it will range somewhere between $10 and $15. It's scalable. It's not at risk of what's called supply chain issues, meaning there are no reagents or things that are needed to extract viral RNA. And so that's something that we're hoping to expand. It has received emergency use authorization. And right now there are about 50 labs around the country that have the capacity to operationalize Saliva Direct. But that's a part of us doing our part. Hey, can we come up with a test that's easy to do, that's scalable, that's cost effective, and it is accurate? And Saliva Direct is one of those. And we think that through a saliva test, we'd be able to have kids test that way.
What would you say to frontline workers, doctors, nurses, people delivering food to people, the police, fire, who are interacting with people all the time? 6 feet is kind of like, almost impossible. What would you say to them that we haven't heard?
I think you've heard it. And I'm going to speak from a position of experience, of personal experience. I'm an emergency medicine physician. I was in the ER yesterday, and I've been working in the ER this entire pandemic, January, February, March, April, May. Wearing the mask, paying attention to your hand hygiene, keeping that distance really does matter. I have been in rooms with people who are COVID positive, people who have come in and have been symptomatic, people who I didn't know were COVID positive, but I was in the room and still didn't test positive, in part because I paid attention to wearing my PPE appropriately. If I coughed or sneezed in my mask, I got another one. Before I went into the room, I washed my hands. When I left the room, I washed my hands. So those principles really do work, having been around people who are positive, but you have to stick to it. Now, if you do have an exposure, the testing is important. And so I'll say a couple things about testing. Again, people need to know where to get testing, and that's an important message. And so there are lots of, obviously, resources that San Diego County has promoting, hey, here are the testing locations. People need to be made aware that some of the big national labs like Quest and LabCorp have partnered with companies like Walmart to offer drive-through testing. You need to be able to call up the hospitals or urgent care centers and saying, hey, where is testing offered within the system, and your primary care physicians. So there are multiple layers of how people can get tested, especially those who are on the front line. And if there has been exposure, getting that. For police officers, for emergency medical technicians, nurses, et cetera, if we're exposed, we can get tested. But for those who may not know, it's important that they have the resources readily available about this is where you can go to get tested should you have an exposure.
Got it. One of the questions we got is anything you learned that's particularly important and relevant to communities of color?
Absolutely. Is that we have to be advocates for ourselves, which we do very well, but also in the context of medicine. And when we look at the historical context, there is a mistrust because we are marginalized, because we know that people of color get less pain medication, because outcomes in terms of prenatal care are different. So we're used to that. But what we also have to recognize is that medicine is powerful and that there's a lot of good that can come when you seek that medical care. And it can only be as effective as it is if it's prescribed and it's taken. And so I tell my community, I tell my patients, this is a partnership. I can have the panacea that will cure you, but if you don't trust me, you don't take it, you don't want to take it, it won't work. So this is a partnership. This isn't me dictating to you what you need to do. This is me saying, these are things that I believe will help you for these reasons. What questions do you have to help lower the barrier to you doing that? But again, it is a two-way street. I'm not a primary care provider, but in my primary care sports medicine practice, what I do after I've seen a patient and it's been a couple months is I call the patient, hey, how are you doing? And so I know that that's a resource that not every doctor's office has, but that's something where it has to be this partnership where I'm not relying on you to say, hey, it's your birthday, it's been a year, come in. It's, hey, it's been a year, haven't seen you, you need to come in for your preventive screening, your blood pressure check, your flu shot, your mammogram, your colonoscopy, whatever the case may be. It has to be a partnership, and we need to be actively engaged in that process as patients and on the medical side.
I hear a lot about, wear your mask, wash your hands, stay 6 feet, and if you get it, quarantine. But what else can people do medically once they do get it to get better versus in addition to just staying away from everybody else?
It's like I teed up that question. That's not a plant, but you know what? One of the players made this tweet and I took note of it. And he said exactly that. We're hearing all this stuff about how to prevent it, but what about how to boost our immune system and how to put ourselves in a better position of not getting it? The principles that are tried and true in medicine hold here today. Getting good sleep is really important. Exercising is really important. And by exercise, I mean just being physically active. And by the way, going for a 30-minute walk is exercise. When we were at the Olympics in 2016, we coined a phrase that sitting is the new smoking, that getting up out of the chair, moving around is really important, that motion is lotion for those joints to keep them active, keep you from getting stiff. And so being physically active is important. Finding someone to help you be physically active, maybe someone in terms of an exercise partner or an accountability partner, is important, but exercise, sleeping, eating properly. I know that with the pandemic, going grocery shopping and being able to pick your food, that has changed somewhat. It's a little bit easier to order out, but making good food choices really goes to boost your immune system. I tell my patients, when you eat, you should, in a meal, have consumed 5 different colors. Try to get 5 different colors on that plate in the process of a meal. That's going to go a long way. It's a challenge. But when you eat well, you boost your immune system. When you sleep well, those cortisol levels go down. And so your body's able to fight off any pathogens or stressors that are coming there. When you exercise, you build up that strength of your immune system. So those things hold true even now in the pandemic. And it's probably more important now than ever to make sure you're getting that in somehow, some way. But those things are there. And then addressing the mental health. And it doesn't have to be signing up to necessarily speak to a psychologist. Calling grandma, calling a friend you haven't talked to, having those conversations, not being isolated, getting out into the sunshine to address the mental health. That's just as important. Those things are going to protect you just as much as the mask, the distancing, and washing your hands. All of those things combined are really what's going to be the most robust in terms of the effect.
You talked about the vaccine, and when you were in the bubble, there was this massive effort to keep everyone away from everyone else, which is not realistic outside the bubble. And the guys and ladies had to be responsible. These are pro athletes. They know the drill, even though they also want to do their own thing. But pretty much they did what they were supposed to. But now that we don't live there, and we have a lot of people who aren't responsible, at least responsible to do the things that we're being told. Taking a vaccine and being forced to take a vaccine is another threshold of getting in people's business and violating people's privacy, if you will. Do you see it getting to a point where everybody is going to have to take a vaccine, or have you learned that if we did these things, it wouldn't be necessary?
So vaccination is going to be important because the only way you're going to get rid of this virus is if we all hide away and kind of starve it out, which is not realistic, or there's some level of herd immunity. And by herd immunity, we're not saying people who have it like the chicken pox, go hang out with someone who has COVID, the virus is too dangerous. By herd immunity, we're saying the exposure in the community to the virus is at a significant threshold. We're going to get there by vaccination. And I understand that people feel a certain way about vaccines. I understand that not everyone can get vaccines for various reasons, whether it's their immune system or whether it's reactions, whatever the case may be. But for the people who are able to get vaccinated, I strongly encourage you to get vaccinated. And that's for a few reasons. Remember, the vaccines operate in different ways, but vaccines not only protect me from getting infected, it protects me from getting infected and infecting others, which brings down the overall community transmission. And so my vaccination is helpful for you as much as it is for me, but in large part, my vaccination helps all of us who I'm around. And so there's a benefit there. So if I'm vaccinated and you're vaccinated and the whole group is vaccinated, now the likelihood of any one of us within the group having it and then transmitting it goes down so much so that the virus starts to go away. And that's what we're looking for with this vaccine. Look, I understand that there's hesitation and misinformation about the vaccine. I will not be advocating for a vaccine until I've seen the data and looked at the research and I feel comfortable that it is safe to do so. This is not going to be one of those situations where it's, we have a vaccine, go and get it. I think there are very credible medical experts who are out there that we should listen to. The vaccine should be FDA approved. The data should stand up to peer review. And this should not be just something that's being peddled in the interest of economics. The data has to stand up. The science has to stand up. And only then do I think I will be comfortable not only promoting it, but getting it myself. And as a frontline worker, I'm one of those people who will have to roll up my sleeve and get it. But I'm going to do it when I know and believe and I've understood the data to suggest that it's safe to do so.
So everybody is dealing with the shutdown differently. You mentioned the mental health, the emotional health of people. I have a lot of personal experience with that as well with family members, and people have lost people have lost their business, they're stressing over money. they're going crazy being in their house. I'm gonna ask two questions in one. One, how can we help those people, and without being counselors? They're very basic things we can do. But two, and it may seem like a separate question, but it's connected. What is the good that can come out of what we're experiencing? And what I mean by that is if it's forcing me to call my grandma more often, if it's gonna force me to eat better, if it's gonna force me, can you give us a list of things how we can see a way to take advantage to be better because of this?
Yes. So to answer the first question, how to help beyond just the recommendation of, say, mental health or behavioral health. One, we have to do the thing that we do best, which is to be a community, which is to support a community, which is to lock arm in arm. That's who we are. We do our best together. We shall overcome, and we can't forget about that. And we need to understand the things that we're comfortable with, calling up friends. We can't shy away from that now. Well, it's been 3 months, so I won't. Whether it's a phone call, a text message, or social media, whatever the case may be, or hosting a Zoom call where you get multiple people together. I understand that Zoom calls, it's pretty tough to have an interaction with 4 or 5 people. You can't talk all at once, but even just that presence matter. The presence is a present. And so one of the things that we can do is reaching out. If it's been a while since you've talked to someone from high school, reach out. Since you've talked to an aunt, uncle, a cousin, reach out. That it really does matter. There's a positivity, there's a release of endorphins, that feel good feeling when the phone rings or when you're talking to someone where you're sharing good memories. It doesn't all have to be about politics and COVID. It could be, if I'm from Chicago, how the Bulls are doing. If you're from LA, hey, wasn't that a good season for the Lakers? You can have a conversation having nothing to do with the virus and with some of these things that raise stress. But that communication really does go a long way. Maybe it's written. Writing is very therapeutic. Writing a letter, typing an email. Maybe you don't want to necessarily pick up the phone or FaceTime or anything like that. But communicating and reaching out and making sure that you feel a part of the community and making sure that others feel connected too. And this is I see my grandma on Zoom every Sunday. I see my grandma now more than I did before the pandemic. And that's a very positive thing for me. She's 88. So that's something that I can encourage. And also getting outside, taking those walks around the neighborhood, saying hi, like not being holed up, the fact that we don't have to shelter in place and you can get out, taking a walk in the park, like those things go a long way. So I would encourage that. And the good that will come out of this, a few things there. One piece of goodness that I think will come out of this is that this pandemic is forcing us to rethink how we do everyday things. What does church look like? What do schools look like? How do we get our meals and our entertainment? So now that we see that we can prevent the spread of infections through certain measures like paying attention to our hand hygiene, through not being around people if we're sick, what we've seen in the Southern Hemisphere is that essentially their flu season is almost nil. In Australia, in South Africa, in Chile, in Argentina, they more or less haven't had much of a flu season. Part of it has been sheltered in place, but not all of those places have been locked down for months on end. It's been these strategies to mitigate the spread of infection. That's going to be a game changer if we're not seeing tens of thousands of people contracting and dying from flu every year. That's going to mean a more robust community. That's going to mean that we're healthier. That's going to mean more we increase longevity. So there's definitely some good from a public health point of view that comes out of this. Again, like if I can keep up that cadence of keeping in touch with my family, my grandma on the regular, there's something that comes out of this. Right. The fact that we are here gathered this way, that I haven't had an opportunity to be with you all and this community this way. And now I am, I've just broadened my network. I have contacts in San Diego. I've met Dr. Hood, who I've known from being an SNMA member. and seeing role models who I've come into contact with, there's strength in that. There's strength in numbers. And now you all have a resource that you know in emergency medicine and sports medicine and the National Basketball Association. And so there is a networking that's happening through providing education to the community that is taking place. And I think there is a big strength in that. If we get to a point where we can talk to the community about the importance of vaccination and we can improve our numbers, we have the flu vaccine, the COVID vaccine will be there. That's going to be a major win as well. I'll conclude with this. In general, there was a time when I was coming up that it was seen as a lack of respect asking personal questions of your elders. You see someone taking a pill, what's that? None of your business. You don't ask those questions. Times have changed. Now the onus is on us to ask those questions. It may have been a lack of respect in the past to ask those, but now it's disrespectful not to ask those questions. Mom, have you gone to the doctor? Are you taking your meds? Hey, bro, have you gone to get a physical? When's the last time you had your blood pressure checked? There is a respect, a decency, and a buildup of the community that will happen. And I'm hoping that that translates to the broader community of people, of young people, older people, everyone. And so I think that that is one of those good points that can come out of this. Not only are we checking in on people's well-being as it relates to COVID, but everyday well-being, and that we're asking those tough questions. We're bringing up conversation pieces that we didn't in the past, things like preventive health measures, things like having not a durable power of attorney, but having your decisions made for end of life care, things like that, things again that were taboo. Now we find a reason to open up those questions and those conversations, and I'm hoping that people will have those conversations about tough topics, end of life, etc.
Before I turn this over to Dr. Hood, we're going to do this rapid fire. I'm going to say a word, and you just say the word that comes to your mind. Okay?
Pastor McPherson, before we get there, Regina told me before we get to rapid fire to give some closing remarks.
Oh, okay. So, I thought you just did it. Okay, got you.
The last few pieces are, number one, this pandemic rages on. The pandemic is not quite at a point where it's coming to an end. And so we have to respect it. We have to continue to be diligent and compliant with those public health measures. We have to continue to support our families, our friends, and build them up, reach out and lend a hand where we can. We have to continue to be our best advocates individually and collectively as a community. We have to be our best advocates. And finally, we have to recognize our power to control our health outcomes, to influence our families and our communities, and to inspire the next generation of frontline workers, healthcare providers, doctors. We have the power to do it, and it's on us to do it. For me, opportunities like this are the ones that I prioritize. I told that to Regina. I get lots of requests to speak. I turn a lot of people down, but when it comes to something like this rises to the front. This is a priority for me. It's a priority for the community. We know that we're a marginalized group, and I have to do whatever I can to do my part, and this is a part of it. Thank you all for having me. Pastor McPherson.
Okay, so I'm gonna give you a word. You just say what comes to your mind, and I think just a word that pops into your head. The Lakers.
Champions.
2020.
Oh.
Okay. That's the word. How about Disney World? Never going back.
No, I was gonna say magical, but you know what? Bubble.
COVID-19.
Awful.
The NBA.
Hardworking.
LeBron James.
One of the best. I can't go GOAT. I'm from Chicago, MJ.
November 3rd.
Mandatory. Show up.
The vaccine.
necessary.
Leroy Sims.
A proud product of my community and wanting to do more. That's not a word. There's no word. I said this to Dr. Hood. I said this to Regina, that I feel a strong sense of responsibility, if not obligation, to my community. That my presence here in the NBA, my presence with the DR in front of my name or the MD behind it, has so much to do with a lot of others who didn't have opportunities that allowed me to get here. People who couldn't go to school, people who had their med school applications thrown out because their name sounded Black or they were Black. That ultimately the door was closed, someone turned the knob, they cracked it open, and now it's wide open. And now that that door is open, it's my job to reach back and bring way more of us through it. And that's what I'm here to do. That is my responsibility. That is what I hope my legacy will be, seeing more people of color rocking the MD, the DO, the RN, whatever it is. That is what I hope for my legacy, for my parents, for my family, for my children. That is what I want out of this position, this visible position with the National Basketball Association, to be a light to our community and to inspire the next generation of soon to be Black doctors.
It is a pleasure meeting you. I know all of us in San Diego are indebted to you. You have a great heart. I wrote down goodness and knowledge. You have goodness and knowledge. So thank you very much. I'm gonna turn this over to Dr. Hood.
Wow. So I have one word, and that's wow. Thank you, first of all, Pastor Miles, for facilitating our conversation with Dr. Sims tonight. You and the Rock Church have been an amazing partner in this work. Thank you, thank you, thank you. And to Dr. Sims, the word is wow, and I'm going to be honest, you make me proud to know that your core, what you do, your background. Thank you for agreeing to speak for all of us. And I want to speak for all of us. We want to thank you for everybody who attended this session. I've been watching the chat and the comments. I've been around a long time. You mentioned you knew me when you were a student. You're telling my age. You have surpassed anything I could have accomplished, making me feel like I have nothing to worry about in the future. So sincere gratitude for all of the work you've done for those of us here in San Diego and around the country by educating, sharing your knowledge and experience, and finding new innovative ways to help us get through the most unprecedented crisis of our lifetime. Also, a deep thanks to our speakers tonight, Dr. Wooten, Dr. Yang. Thank you. I extend my gratitude to the San Diego COVID Equity Task Force, to the County of San Diego, and I must acknowledge those that kind of brought us here. First of all, the Multicultural Health Foundation Board, the members of the Equity Task Force, Dr. Susan Afalo, Regina Evans-Jarrett, Dr. Robert Gillespie, Dr. Reese Jarrett, Student Minister Walilia Muhammad, Kevin Liu, who's a Multicultural Health Foundation technical support. And I want to thank Cynthia James, new member of Multicultural Health Foundation, who is the program manager for the Multicultural Health Foundation Black COVID Communication and Outreach Initiative. And I also want to thank our consultants that helped bring this together, IVC Media and Jay Walker Communications, as well as the Neighborhood House and their CEO, Rudy Johnson. We hope everybody who joined us tonight was able to perhaps learn something new and take away something that they can bring to their communities, friends, and families about ways to help reduce and eventually eliminate the spread of COVID. And last but not least, remember, do our part, do your part. Wear a mask, social distance, wash your hands frequently. Once again, one last reminder to please take our survey. You will receive a link to it via email after this meeting concludes. Thank everybody for a great night. Stay safe. And again, Dr. Sims. Wow. Thank you, everybody.
Thank you.